So, Neil, you run an entire healthcare network with hospitals, clinics, and staff. Why do you feel it was important to invest in communities of practice and to explore digital incentive based coordination?
Well, I felt that given the population that we serve and the number of chronic diseases I see coming through the population, that we weren't as effective as we could be in addressing their needs. We do a community health needs assessment every few years, and every few years we get the same chronic diseases rising to the top that need to be addressed. So clearly, whatever we're doing, no matter how hard we're trying, we're not having the kind of positive impact we should be having. And I'm realizing that we needed to do something different and try something different to see if we could have a more positive impact on the health of the communities that we serve.
That's exactly what I thought you'd respond. But most people go down the route of personalized, hyper personalized, personalized to an individual. Why did you think it was important to go for let's not personalize to individuals, let's talk to people as parts of a community?
Well, one of the things that I've learned over time is that things move at the speed of trust. And trust is a strong basis of an individual's accepting advice. And what I'm learning is that from a health equity standpoint, I can't necessarily be the person re- addressing a unique population. So we needed to create populations of like individuals with like diseases and like communities who would be more credible to each other. And my belief is that by pulling similar individuals together, that they will listen to each other, they'll learn from each other, they'll take the advice from each other, and hopefully begin to move their health forward in a way that we can't seem to accomplish given more traditional approaches. I also think it creates a sense of camaraderie. It creates a sense of accountability to each other, not necessarily to us, the healthcare provider, but to each other in the community. They each one of them want to assure that each other is moving forward. You begin to develop a personal relationship and a desire to see someone's life and health improve. And I think that's where the psychology in all this may take place. I've realized through the years that oftentimes people know what to do, but they just don't do it. You can't necessarily motivate someone into doing it by insisting it's the right thing to do. They've got to believe it, they got to feel it, they got to hear it from people they respect, and they've got to see the success of others to try to motivate themselves. And I think that's where the magic in all this happens.